Good evening, everyone. Myself, Dr. Ashish Kale, Chairperson of Fogsi Family Welfare Committee. Today, we have a special guest, and this is a 190th episode of podcast. When we talking about the research, there are multiple things come into our mind, and the most important thing when you research about the particular thing in our ART field, or maybe for that matter OBGYN, the two prominent names come into our come in our mind, and that the first name is our own president, Dr. Sunita Madam, because when you're talking about the stem cell and its potential in our regenerative medicine, she is the pioneer and research work, and today's guest is again the research worker who is done a pediatrics from clinical side and venture into ICMR and become a scientist there, research scientist. So it's really a privilege for all of us to listen from both the personalities. One is our own president of Foxy, and another guest. She is Dr. Amlin Shukla, and she's now heading a position of a research in ICMR. Before going to our podcast, I request our president of Foxy, Sunita Madam, to have a few words for us.
Hi, good evening, everyone. It's so nice to know the way our podcasts are moving ahead, and I'm glad for that. Ashish, you always come out with the fantastic faculty, and the podcasts are so interesting to hear about. And Dr. Shukla, thank you so much for coming on a Foxy platform. It's like 180 plus podcast series, and every day from 29 January, 8 p.m., 30 committee chairpersons on 30 days with different faculty. I think it has become one of the richest podcast series what Foxy can gather in. And every dialogue, every podcast, every interview is so, well heard. And it is so important for everyone, whether from the medical or a non-medical background. And today, with you, I think Ashish is going to open up the different chapter altogether. So thank you so much for being with us. And I'm sure you both will enjoy the podcast.
Thank you, madam. Thank you for those words. And always, it's a for me, it is always a motivation things because at 8 o'clock, where madam is in doing the OPD, doing the surgeries, whatever platform she is, she makes sure that 8 o'clock she will be with all of us. And this is a real leadership quality, madam. I should learn from you. And when you committed everything from your heart. And thank you for being there. And
Thank you, Ashish.
thank you, ma'am. Thank you. Uh, Friends, now we are moving to the another guest of honor today, and we are having when we talking about the research. I think the particular mind come into my particular sentence that comes into my mind that you have to publish or perish. If you wanted to do certain things in life, it is always the research, and that makes you what you are. And after the certain years, that research is come into guidelines, and that will give up huge tremendous efforts that you had made into a clinical practice for the betterment of our patients. So today we have the none other than Dr. Amlin Shukla. She is a pediatrician. She had done her pediatrics from PGI and she was working there. And after working for the pediatrics for a couple of years, she ventured into ICMR, and now she's leading a researcher in ICMR. So today's podcast, madam, related to the opportunities for the impactful research through the grants of ICMR. Why I select this particular name? Because every research requires something motivation about the topic, and then the when you venture into a research, you require some of the grants from the organization where you can do it at a national level. So, Dr. Amlin, I wish to ask you first that we know ICMR guidelines formations because we go through the when you are as a clinician, because you are a pediatrician, we are obstetricians, so we form that cohesive bonding. When we talk about anything about the ICMR, first thing comes in our mind is the guidelines. But apart from the guidelines, can you able to tell me how the ICMR works for the different research modules? And I know that your area of interest is a rare disease and genetic diseases in neonates. And secondly, madam, I gone through your various podcasts and various lectures wherein you talk about the PCOS and its implications as a phenotypes and of the PCOS and its genetic abnormalities. So over to you, madam. How the ICMR really helpful for all of us in relation to the research module?
Right. So before answering the question, I thank you, Dr. Ashish and Sunita Madam, for inviting me to this, I mean, very exciting talk. And I'm really excited about talking to and informing all the obstetricians and gynecologists who, apart from working hard as clinicians, are also taking part in research and showing interest in advancing medical technologies, knowledge, and research in this country. And the stalwart being you, Dr. Sunita, and you have taken such an amazing initiative. And it's astounding that it's the 190th episode, and I really, really congratulate you for that.
Thank you, madam. Thank you, Dr. Amlin. It's wonderful. Our protocol is I just joined to welcome you on behalf of Foxy as a Foxy president to show the respect to the faculty. And now I'll go to the viewer link and you both enjoy your podcast and I'll listen to both of you.
Thank you,
Sure.
ma'am.
Thank you.
Thank you.
Thank you.
So, Dr. Ashish,
Yeah.
coming back to your question. First of all, I would like to talk about how ICMR prioritizes the research. So, ICMR has, if I wanted to talk just in two sentences, how ICMR prioritizes its research, it would be aligning itself to the national health programs and focusing on solution-based research. So conventionally, what has been happening over the past year, we got a chance to reflect upon the research that we were conducting till to 2022. And we found that most of the research that we were conducting was descriptive in nature. Uh, Most of the investigators, the researchers find it easy to describe problems like conducting surveys and prevalence studies and finding what is the problem. But then the realization came that we have done enough to describe these problems. Now let's move over to finding out the solutions for these problems. So there are numerous issues that are, faced by our country, and there are expert bodies with ICMR, Scientific Advisory Board. The Governing Council of ICMR has several experts who help us, settle down and prioritize the research priorities according to the alignment with the national programs. And, events such as pandemics and like COVID taught us a lot about what was the actual research requirement for the country. So, starting with COVID, I would say that the pandemic taught us a lot, and we felt that advancing genomics research, genomic surveillance, then providing AI and digital technologies for as basic, healthcare system as a primary health center is a very important piece of research. Apart from this, there are certain difficult areas of research. Uh, difficult problems to be tackled. So ICMR defined 11 research priorities in around 2022. And these were mainly in communicable diseases, for example, antimicrobial resistance. Then One Health, tuberculosis has always been a major problem. It continues to be. Vector-borne diseases are big problems. Then in non-communicable diseases, there is diabetes, hypertension, other cardiovascular disorders. Mental health is a big issue. Then oral health has always been neglected. So ICMR identified that also as one of the, national health priority. And then cancer, of course, everything related to cancers is a national health priority. Then how can we leave behind maternal and newborn health and nutrition? So newborn mortality is one of the national health research priority. And apart from that, anemia and nutritional issues like stunting and wasting. So these 11 difficult areas were identified, and the primary healthcare setup, the Ayushman Arogya Mandirs, how they are best utilized, is an overarching area over these 11 areas. So this is how ICMR has set its priorities.
Madam, when you're talking about the ICMR, what I gather from you that it is always in action with the government policies and national programs. So if we say about the maternal and child health, because I am leading the position of a Fogsi of Family Welfare Program, so we have a contraception, we have different baskets of contraception, and one of the thing is that we are a populous country. So saying that, what is the guidelines as far as the neonatal diseases are considered, or the maternal health for that matter? So because we in a Foxy start with the Sampurna series, wherein we taken care of a pre-conceptional health, mental health and physical health. So do you think that ICMR also should be venture into that particular where the mental and physical health will be appropriate prior to the conception in order to reduce down the maternal complications during the childbirth?
Yes, absolutely. So if you find the particular website where ICMR grants are to be submitted, that is the EPMS website. You can write it down. So you can visit that website, and for every grant cycle, we mention a list of priority diseases that the investigators can focus on. So mental health and maternal health, including the preconception care, they are definitely the research priorities.
Okay, can Madam you throw us a light on what are the research which has been taken care by the ICMR and its real world data? Like if you are thought of giving the grants by the ICMR for this research project, and which will turn into a real time working project for that particular faculty, like for OBGYN for that matter, or maybe pediatrics. So can you name a few of us to understand how the this particular system will work?
I think I didn't get the question correctly. Can you rephrase?
Yeah, I said like we know that the ICMR grants are been there for some research projects, and it has already been funded for many of the projects. Like in OBGYN, we talk about Manyata project, and there are certain projects which have been already been given the grants by the ICMR. So
Mhm.
whether these particular research projects has an impact on the real world, that's how the things are moving. Because we as a obstetrician, if I'm working at some of the remote place in India, so how I will be going to know what the ICMR grants are for and what is their real time projects and implications?
So, the if you want to find out the implication of your project, you found out some new solution to a problem, or some new diagnostic test, or new something evidence-based intervention you found out. So, Department of Health Research, which is a parent organization for ICMR in the Ministry of Health, they have a scheme called Health Technology Assessment in India. So HTAIN is the name of the scheme, and it is for evaluation of clinical, social, economic parameters of whatever the health research is conducted. And about 272 studies have already been conducted by the HTA initiative, and they have suggested whether the health research and the outcome of the health research is clinically effective or not, whether it is cost effective or not, whether it will lead to an impactful solution for an important problem, and whether should government take it up. So all that kind of policy guidance is provided through this kind of research. So it is for all the researchers, if they feel that their technology, whatever they have developed, should be assessed, they can look up to that scheme.
Okay, madam, just a personal side of yours, being a clinician and being a practicing pediatrician, how you venture into this ICMR and research? Just have an idea because we always thought something new in our own clinical things, but how you develop interest into the branch where all of us are new, or most of us are new.
Right. So, I think whenever I go to ICMR every day, I feel like I have to justify my existence at ICMR because before coming to ICMR, the same hands that are now writing papers and making protocols and giving out grants, they were saving babies, which is
Yes.
much more important task to do. So I have resuscitated babies. I have saved babies in NICU. And yeah, so the major motivator for me is to make a bigger impact at a public health level. So in conversation with the Director General of ICMR, so he taught us that through implementation research that is the major focus area for me at present. You can save many more babies that you are saving directly as a clinician.
True.
So that is the motivation for me. And whenever I come to ICMR every day, I tell myself if I don't do enough to save more babies than I was already saving as pediatrician or a neonatologist, I'll leave ICMR. So that's the motivation.
And madam, when you are like talking about the ICMR, there are the grants and there are the researches. How anyone can enroll about the fellowship programs of ICMR? Is there is any protocols to be followed or any exams to be given to enter into this particular stream of knowledge?
So I can tell you about the programs. The details can be found in the websites. ICMR gives out various kinds of fellowships. So, for example, if we begin at a more junior level,
Mhm.
there are short-term studentship grants are given to MBBS doctors. Then there is a scheme called MD thesis scheme is there. So the postgraduate students who are just starting to work on their thesis, they can apply for thesis grants. So the students in the MD and MS. And then there is particularly for women, there is women scientist fellowship is there. Uh, Taking into consideration that women have to take a break from their work when they give birth to babies or for family reasons, if they've taken a break. Now they want to restart and do some research activity. So such this fellowship can be availed by them, and it can be looked upon in the ICMR website. It is there. The details are there. So up to 10 lakhs over 3 years can be provided for the research work that is done. For the mid-career clinicians who are interested in research, there are different kinds of fellowships available in India and abroad. It's a DHR fellowship initiative, so it can be found on the DHR website. And there are several short to long-term fellowships. So I would not know all the details, but
Yeah.
these are the fellowships that can be found.
Okay. Now the like being again into that position, what advice would you give to the young investigators looking to align their research ideas in ICMR fundings and priorities? Because if I wish to do something, that it should be aligned with the ICMR guidelines, and I wish should get at least a good amount of the grants. So how that the advice you can give it to the youngsters?
Exactly. So I just told about the priorities of ICMR. So first of all is the thing is that the researcher has to be aligned to the priorities of ICMR. And ICMR priorities are not difficult to understand. They are always aligned to the national health priorities. And apart from this, we also mention the priority areas in all the grant cycles. Whenever a grant call is out, I think we have a grant call for maybe the Center for Advanced Research call is on at present. So the interested researchers can look up the EPMS website of ICMR and find out. So if I tell about that, so the Center for Advanced Research is a 5-year research grant, and over these 5 years, up to 15 crores can be taken up as a grant. And but the catch is that for centers for advanced research, the researchers who already have some prior experience of conducting research are usually selected for this kind of research grant. We have just finished up with our this year early cycles of small and intermediate grants. So small grants are up to 2 crores, and intermediate grants are 2 to 8 crores. So small and intermediate grants can be taken up by new researchers also. And another way for your grant proposal to be accepted is to build up on a research area that was previously funded by ICMR. So already, if some work has been done in one of the research grants, if you take up that area and build up on it, there is more chance of the research being funded. Apart from setting priorities and aligning yourself, you have to write the research proposal in a manner that it looks compelling for the reviewers, because ICMR has a very stringent review process and multi-layered at several levels. First, there is an internal review by the ICMR scientists, and it is followed by a review from external experts also. And finally, at the highest administrative level, 3 levels of review are there. So if the grant proposal cannot speak for itself, then the chances of it getting funded thin out. So starting with the title should be very clear and not something vague like empowering health of women. It's not a good title. So title should reflect your population intervention outcomes and the area where you're going to do the research, the geographical areas. So then the objectives should be, we call something as SMART objective. So it should be specific, measurable, and achievable, and translational. So SMART objective should be there. And then before you think of submitting the paper, thorough literature review should be there. So if the area you're choosing is aligned to ICMR priority area, but the research has already been done several times in the past, then again the novelty component goes down and the research will not be funded. Then the methods and the implementation plan should be written very clearly. It is very, very important. And sample size estimation and how the several phases of the study will go on. Everything has to be written clearly. And at the end, you have to let us know that what impact your research is going to make. Don't overestimate it also. And sometimes, even after writing a good research proposal, there are 2 more things that might lead to the rejection of the proposal, which is not forming teams properly. So in the recent intermediate grant review, we found one such submission, which was written very well, but it was an implementation research and only 2 investigators were there in the team. Implementation research cannot be conducted without collaboration between the researchers and the implementers, that is the state team, the government, who is the governing body there. So it means that the researcher has some knowledge but has not conducted, no experience. So once you go out in the field, you will find that implementation research cannot be done without having a multidisciplinary team. The second thing can be, budget. So some of you might feel that making your study under budgeted might help in getting the proposal, which is not true. Because I will tell you, because once you write the proposal, you should have adequate knowledge of how to implement it. If you make your study under budgeted, then the reviewers will know that you don't know how to implement your study. So being under budgeted is not the key. So, and of course, over budgeted is also not the key. So the submission should have adequately, made budget plan.
Madam, when we talk about the rejection, in what we do in a research of, if I wanted to publish in any of the national or international journal, we always, if the rejection happens to the author, we resubmit it, making some modifications into that research, or maybe again come back and then we review it and then again resubmit. Is there is any possibility of the same thing happening at your side when you when the some young researchers go for the grant and he's rejected because of the some reason? Is there is any scope again to resubmit or
Yeah, that does happen. But if there are too many flaws, I mean, it depends upon the balance between the positives and the negatives. So once we feel that the positives are a lot, and the area is such that no one else has, opted for doing a research in that area, it's a difficult area, or maybe a difficult region like Northeast region or a tribal area for research. Those projects might be given priorities, and we have actually helped the investigators who have submitted these proposals to help develop their proposals. Like especially implementation research is a very new area, and many people do not know about it. They submit uh, papers, grant proposals on gap analysis and finding out facilitators and barriers, which is not implementation research. Implementation research is finding out the barriers and facilitators and co-developing the implementation research plan with the collaborating implementation team, which is the state, and then implementing those solutions and finding the model finding. So most people are not able to write the proposals in that manner. But if the if the grant proposal submitted has enough positives, like most of the things have been written properly, just to help them, we might decide to, on one-on-one session and help them develop. And also ICMR conducts several webinars during this time of the grant cycles and otherwise also on implementation research and several kinds of researches like pragmatic trials and all, which are new and upcoming areas. So, it is regularly advertised on ICMR website and elsewhere. So the people who are planning to submit the grant proposals can also take advantage of those.
suppose if we are a Foxy and we are a organization of 46,000 gynecologists and we have a different committees and different modules to work on, we have a different projects. Suppose if as a committee chairperson, I wish to have some projects and wanted to go it because we have a Northeast also, we have a Gujarat, we have everywhere gynecologist. And if I come across like implementation of a LARC methods for the better compliance of the womanhood. Suppose that is the object of the study. How that can be done in a pan-India studies and how the ICMR, I will be going to get benefit from this particular interaction of the podcast, wherein I will get to know how the things can work.
Yeah, so for developing multi-center and projects that require more than one specialties, so especially the projects which are spread across the geography of the country. First of all, you will have to develop your own network of obstetricians, and you might need support of some public health expert also. And then methodologist might be required to, help you and develop more complex proposals. And if the proposal involves newborns also, then maybe pediatrician or
There is
neonatologist. So it goes without saying that the nature of project will determine the team. So if your team has adequate specializations according to the need, then nobody is stopping the proposal. If it is written well and has a requisite team, yeah, it should go ahead.
Okay, now I will ask you, how important is a collaboration both as a India and internationally when you are accelerating the transitional of a research finding into a policy and practice? What I mean by it, if you are going to go with the some research and we are collaborating with the different agencies or different nations internationally, how that will implicates us into making a policy? Because I've been to the meeting of FP 2030 in Nepal, and we know the mission that time. JP Nadda ji talked about the population control and stabilization, and I know the things how the donors will work and all that thing. But still, when we are talking about ICMR and when we're talking about the policy making and the practices, how international collaborations will be helpful for that matter?
Yeah, international and national collaborations and regional collaborations. So all kinds of collaborations, they are required, they are necessary. And later I would also tell that what kind of collaboration might not be helpful. So first, focusing on the positives. So international collaborations, as all of you would know, that they are helpful for knowledge sharing. They let you develop more evidence-based solutions to a problem. And then they give you more credibility, especially if you're collaborating with institutions like National Institute of Health, for example. So the solutions coming out might have more policy implications because then you know that the credible minds have worked together. In the same way, national collaboration and regional collaborations are very helpful, like collaborations with various institutes for research, then collaborations between research institutes and the government, collaboration with like one outcome of a collaboration between ICMR and medical colleges are the this multidisciplinary research units. So ICMR has set up several multidisciplinary research units at medical colleges in the country, and not only at the medical colleges. ICMR has also developed model rural health research units, MRHRUs, at more basic primary health center level. So this is an example, and it has been really reaping results. We have been trying to find a solution to local problems and trying to help technology penetrate more through these research institutions. And then we have, like, for example, ICMR has developed standard treatment workflows for about 53 diseases and with the help of 300 experts. And now that has been endorsed by the government, and webinars are being conducted, and at the primary health and CHC level, PHC level, medical officers are being tutored and guided for treating diseases. So it's creating a decision support system for them. So these are the benefits of the collaborations. And in fact, for international collaborations, there is a special division called International Health Division at ICMR. ICMR also, approves collaborations between India and researchers in India and other countries through Health Ministry's screening committee. So where I have to focus on the cautious issues that have to be focused on when we are collaborating. So sometimes the collaborations might be predatory. So there might be some kind of interest in data from the country and getting to know about various diseases and demography of the country. So the collaborators, the Indian collaborators should be cautious of such kind of collaborations. And HMSC does not encourage such collaborations. And if someone has applied for HMSC approval and they have not got approved, they will get it written in the comments that
This data.
data sharing is not clear, or it appears to be a data mining activity. So such collaborations are not encouraged. The collaborations which strengthen Indian research, which strengthen the Indian researcher and find something meaningful for the country, they are most welcome.
Okay. So when we're talking about NHS surveys and we now coming up with the different data from the government agencies, do you in ICMR has some mechanism or maybe in a place something which if the research come up and that will influence the health national policies, is there is anything that ICMR has in place so that it will have a particularly if I done some research and that will influence my policy making in a government level. So does that mechanism exist or can you elaborate something like that?
Yeah,
Please?
like I told about the HTA. So that is one mechanism that through health technology assessment, the ICMR assesses and evaluates the research that has already been done. And if you have a look at the submission cycle of ICMR, it's always the researcher has to mention the translational value of their research. So this is another way of encouraging that and reminding the researcher that the research that they undertake should have translational value. And if the research is aligned with the national health priority and it's done in a proper manner, then it definitely will have impact. And we have examples for that. And another way ICMR is helping, deliver the evidence-based solutions to the people who need at the end is implementation research. So through implementation research, most of the national health research priorities, now we have 33 projects. And I would just tell you about the National Health Research Program. It is a relatively large funding program, and up to 25 crores of funds can be, given out through this National Health Research Priority Program. And already 33 programs, such projects are running. The thing is that ICMR initiates expressions of interests for these NHRPs, the National Health Research Priorities. And very shortly, we'll be having another expression of interest for preterm care. And it does have some implication for the obstetricians also, because one of the components is use of antenatal corticosteroids.
Yes.
So I think it will come out within this week or maybe early next week. So I'm just informing in advance to just look out for this. And this expression of interest will be applicable for the teaching institutes and the researchers from NICUs and SNCUs. They will be eligible to apply for that.
Okay, now coming to the our generation as a quite we talk about old generation, but now generation is a Z generation Z or Gen Z you call it. Now there is a chat
Yeah, in the
GPT.
older generation.
No, then there is a possibility that the people are now using the chat GPT, AI, genomics. So ICMR, because if I wanted to become a research oriented person, I just do a chat GPT, get the questions, get the research done. So is the ICMR having the adaptive technology to deal with such a kind of a advancement in technology? Because usually nowadays thesis has been made in a such a easier way.
Exactly. A very, very important question this is for this day and age. And I would like to inform that ICMR has recently, made the ethical guidelines for use of artificial intelligence in biomedical research. And it pertains to all spheres, including diagnostics, therapeutics, evidence generation, and everything. So I would suggest to use that resource when you are planning your research, and please go through that. Apart from this, ICMR has a separate AI cell
Okay.
for all the projects that are on artificial intelligence. and they are very stringently scrutinized and understood when the proposal is being submitted. And apart from that, genomics is a very important area. So for that also, ICMR has developed a priority area in genomics in cancer, rare diseases, and pharmacogenomics, and population-based genetic studies. So just to keep up with the new generation.
Okay, madam, then there is a like it's my own personal interest. The question may be the long term. You had done a research on a long term neurodevelopment and mental outcomes of neonatal chikungunya till 1 year.
Yeah.
What was your like how you venture into this? First, my question will be. Second question will be: we know there is a long term implications for anything like a simplest to a birth asphyxia to all the viral diseases, and how you are looking forward, like being a pediatrician and being a renowned now into the this particular field. How you find out this area of research, and what is your uh, inputs or what is your outcome of this particular topic? Because I as a obstetrician, I was very much interested in knowing this particularly.
Yeah, I don't know if it happened in your region in 2016 or not, but I think New Delhi was badly affected with chikungunya in that year. And suddenly we were getting several babies like not responding, like coming in shock-like condition, not responding to anything, to antibiotics, and developing brownish discoloration of the skin. And we were perplexed by this situation, and we were going through the literature, not finding anything. So we just started observing these babies. So this was a case series of I think 13 babies that we observed in our NICU, and we found several neurological manifestations of chikungunya which do not occur in adults. Adult chikungunya is entirely different. It has joint pains and other bodily symptoms, but neurological symptoms are not predominant. So it was not easy to diagnose. And we started to get the RT-PCR done and then found out that this was actually chikungunya. And after we assimilated these cases and published, after that, some other reports also started coming. Then it got confirmed that chikungunya is presenting like this. So it was like something very new and informative for us. And we really wanted to share this information with all other pediatricians and people who are dealing with newborns. And then we found we kept on following these babies in our neurodevelopmental clinic. And I worked at Ram Manohar Lohiya Hospital. And we followed these babies and found that there were several long-term neurological deficits, some tone problems.
With regards to long-term sequelae of this, madam,
Yeah.
like what they have tone.
Some had global developmental delay, some had tone problems, hypertonia, hypotonia, some stricture formation. The skin manifestations disappeared, but the neurological, these kind of manifestations, they persisted in many movies. So that was, we thought that it was unique and something to share. So that's why we published it.
Again, madam, like being a ART person, and I'm running a IVF clinic across the globe. When I come across another paper of yours related to the PCOS and the age of menarche, we know the phenotypes are now A, B, C, D, and we're talking about the phenotype, and we're not called PCOS. We call as now it is a multi the etiological disease. So coming to that paper and coming to that research for that matter, what is your take on that, particularly when you're talking about the Indian woman reproductive age and their menarche, the trends of onset of age and association with the presence of PCOS. So is it variable across our India, or whether it is a phenotypically related to? because we also, when we go for the stimulation protocols for IVF, we never talk the PCOS as a normal responder. We talk about a hyper responder and not a normal etiology. So, do you think in your research, where you talk about the PCOS and the age of menarche, where it's variable to the what do you call it, country specific or maybe region specific? What is your research related to that?
Yeah, we found that the phenotypes that you're talking about, apart from that, we also found some incomplete phenotypes that were not fitting in all the criteria, and we could not diagnose them as PCOS. But at the same time, we found that they had other, risk factors for for metabolic syndrome, like hypertension. Some of them had, and some of them had obesity.
Yeah.
Mhm. So we didn't, I think, go ahead after that of investigating further these women, whether they progressed into PCOS later on or not, because that study ended. But that was something very interesting we found in that study. And with regards to the age at menarche, I think we found that the age of menarche was a little later in the women women who developed PCOS. But that analysis had some limitations of recall might be there, because that was a cross-sectional study, and we were having women from 18 to 40 years of age. So we compared the age of menarche of women who are at
Yes.
about the end of the spectrum, two ends of the spectrum.
Okay.
So they were generationally different, but uh, definitely some recall issues might have been there, but this is what we found.
Okay, now, madam, we are talking for the last 45 minutes uh, without getting insights of getting research and research related to the. I think this is the unique podcast wherein the clinician is talking to the clinician, and in the background of the clinics, we always talk about research. But, madam, what do you think of like a new generation should take a home message from you, that what they should be doing, because all of us they wanted to take a clinical branch, excel in a clinical branch, and make a name and fame, and then they suddenly they thought in the mind that I had not done perform very well in a literature and the research, and then the time has what do you call as the time is not been there at their hand. So what is your advice to the younger people, and those are nowadays younger generation is much more smarter, so they want everything in a faster movements. So what is your advice to them, madam?
So when I think about it, I feel that all these newer advances in medicine and surgical methods and all the everything that we have, is it not because of research? So research is what has made these things available for us. We are progressing because of research. So don't do research just for the heck of it, ki, my literature review and this and that. Whenever you are doing your MD thesis or enrolling in any research activity, try to do it because of the curiosity of it and because of the impact that it is going to bring.
Right, yeah.
So, being a clinician, I would not say it was difficult for me to, you know, transform from being a clinician to a researcher, because I had this motive of doing something impactful, something that will bring about a change and to inform and tell whole world about it. So I think being a researcher is a great. It should be definitely thought of as a career option. And in fact, again coming back to ICMR, ICMR is now offering MD PhD course. So I think it is being offered at KGMU and Lucknow, and one more institute is there. So 25 seats in a year are there, and the uniqueness is that after the MD, if you want to be a researcher, continuous 2-year PhD program will complete your PhD also. So you are a clinician as well as a scientist.
Right.
So
We start our podcast with the first sentence you uttered, that you said that being a pediatrician, these hands are saved a few babies, but being a researcher and becoming into this ICMR, your uh, father figure in the ICMR told you that you can save many more babies become because you can make a research into a reality. Madam, what is the passion that drives you? And when you take a first sip of coffee or maybe a cup of tea in the morning until the end of it, now it's 8:39. What makes you keep going? Because there are vast responsibilities. I've seen in your CV. You have done a lot of things in this short period of time. I may say, but what is your that gene inside that makes you keep going on and on in a different zones of medicine?
The zeal is because of the inner, attitude of a learner, of a student. I think because I still am a sort of a beginner at ICMR. I joined ICMR in 2019 only. So there are a lot of new things that I learn at ICMR. And if I quote one famous person who is Dr. V.K. Paul, who was the head of the department unitology of AIMS and now is an honorable member of Niti Aayog. What he says to us is the winners have to win every day. So you have to do something like if you set out to do some set of activities in your day, you have to complete it and you have to complete with full efficiency and you have to win it. So that keeps me driving. So if I feel that if I have to win after 5 years of this project, I have to win today also.
Yeah.
That's what drives me.
Thank you, madam. Thank you very much for giving us these precious moments of your life and some take-home messages. I personally myself feel privileged because being into the practice for the 15 more than 15 years, I never thought of taking the interview of the person who has both the sides of the coin. That you are a clinician, you are a researcher, and now the last sentence you uttered that every day you wake up with some task and you have to achieve with the same energy. I think that gives all of us and those who are watching this 46 gynecologists across the India watching you live. I think there is a something that I should take as a message from you as a person is that the journey never ends and your learning never ends. What you talk just in a few minutes back. And madam, from the Foxy and from the our side, we are really thankful to you for giving your precious time to all of us and gives the insights about the ICMR. Because as for us is ICMR, when we research, we talk about guidelines. We talk about only the thing is research, which we never understood. And you make us so simple that we know now APS, we know DHR, where to get the funds, how to do the fellowship, how to do the PhD if someone is interested in doing that. So really, it is eye opener for all of us to having you here, madam. Thank you very much from our end being there. Thank you very much.
Thank you so much. It was so nice talking to you. Thank you.
Thank you. Thanks a lot.